It's a great pleasure to tell you about neurodevelopmental outcomes of neonatal seizures in very low birth weight infants using the Korean neonatal network data. Our aim was to assess the influences on long-term neurodevelopmental outcomes of neonatal seizures requiring antiepileptic medications in NICUs among very low birth weight infants. A total of 7,599 very low birth weight infants born from 2013 to 2018 and followed up at 18 to 24 months of corrected age were included using the Korean neonatal network data. Among the 7,599 very low birth weight infants, 425 infants, 5.6% had neonatal seizures in NICUs. We assessed the influence of neonatal seizures requiring antiepileptic medications in NICUs on the mortality, blindness, deafness, cerebral palsy, and neurodevelopmental impairments, both mental and motor neurodevelopment, by multivariable logistic regression analysis with the backward elimination method, adjusting for perinatal and neonatal morbidities in NICUs. We also compared clinical factors between the good and bad neurodevelopment in infants with neonatal seizures. Bad neurodevelopment was defined as any cerebral palsy, blindness, deafness, and neurodevelopmental impairment, including both mental and motor development. Mental developmental impairment was defined as mental developmental index scores less than 70 on Bayley 2 test, or cognitive scores or language scores less than 85 on Bayley 3 test. Motor developmental impairment was defined as psychomotor developmental index scores less than 70 on Bayley 2 test, or motor scores less than 85 on Bayley 3 test. We performed multivariable logistic regression analysis with the backward elimination method, adjusting for all factors mentioned above, plus gestational diabetes, histologic chorioamnionitis, multiple birth, in vitro fertilization, oligohydramnios, hypotension within the first week, sepsis, and days to full feeding. Neonatal seizures increase the risk of deafness, cerebral palsy, mental developmental impairment, and motor developmental impairment. However, it did not increase the risk of blindness and mortality after NICU discharge. When we compared the clinical characteristics in NICU admissions between the bad and good neurodevelopment groups in infants with neonatal seizures, there were no significant differences in gestation age at birth and the proportion of male gender. After multivariable logistic regression analysis with the backward elimination method, adjusting for gestation age at birth, male gender, multiple gestation, in vitro fertilization, sepsis, necrotizing enterocolitis more than stage 2, intraventricular hemorrhage more than grade 3, moderate to severe bronchopulmonary dysplasia, and hospital days, necrotizing enterocolitis, severe intraventricular hemorrhage, and longer hospital day were significant risk factors of bad neurodevelopment in infants with neonatal seizures. In conclusion, neonatal seizures requiring antiepileptic medications during NICU admissions increase the risk of cerebral palsy, deafness, and mental and motor developmental impairments at long-term follow-up of 18 to 24-month corrected age. Reducing neonatal morbidities in NICUs is important for improving long-term neurodevelopment in very low birth weight infants with neonatal seizures. Thank you for listening.